Black tea is officially the most consumed tea variety on a global scale, accounting for nearly 75% of all tea consumption worldwide. Much of its immense popularity comes down to its incredible versatility, as it can be enjoyed warm during the winter or cold during the summer, and it tastes great whether it is served plain or with a touch of honey and milk. Beyond its taste, black tea is highly valued for its rich antioxidant content, which has been shown to help reduce inflammation and support healthy cholesterol levels. However, despite these many positive health attributes, there is a critical factor that many daily tea drinkers often overlook. The very same beneficial compounds that give black tea its power can also significantly interfere with how certain medications work within your system. Black tea contains a complex mixture of caffeine, tannins, and other polyphenols that can influence the absorption and metabolism of various drugs. Depending on the specific treatment you are taking, black tea might increase unwanted stimulant effects or drastically reduce how well essential nutrients and medications are absorbed by the body. Pharmacists and dietitians are now working to educate the public on which common medications should never be mixed with a daily cup of black tea to ensure patient safety and treatment efficacy. One of the most notable interactions involves stimulant medications, such as the amphetamine-based drugs frequently prescribed for individuals with attention deficit hyperactivity disorder, or ADHD. Because black tea naturally contains caffeine, it can create a powerful and sometimes uncomfortable additive effect when combined with these pharmaceutical stimulants. Seth Polson, who is a doctor of pharmacy, explains that caffeine can intensify the side effects of these medications, leading to increased jitteriness, a higher heart rate, elevated anxiety, and significant trouble sleeping. Since both the medication and the caffeine stimulate the central nervous system, even a moderate amount of black tea can feel much more potent and overwhelming than intended. To minimize these adverse reactions, it is highly recommended to take your stimulant medications with plain water and wait at least 1 to 2 hours before enjoying your first cup of black tea. This specific window of time allows the medication to begin its work without being immediately impacted by the caffeine in the tea. Iron supplements represent another major category where timing is absolutely essential for success. Recent studies involving large groups of people have shown that roughly 29% of individuals suffer from low iron levels, making supplements a vital tool for resolving deficiency. However, the effectiveness of an iron supplement is heavily dependent on how and when it is taken. Black tea is exceptionally rich in tannins, which are organic molecules that have a tendency to bind to iron within the digestive tract. When this binding occurs, it creates a complex that the body cannot easily process, which significantly reduces the amount of iron that actually makes it into your bloodstream. To prevent your tea from sabotaging your iron levels, pharmacist Jane Moon suggests a very specific schedule. You should aim to take your iron tablets 3 to 4 hours before you drink black tea. By creating this substantial gap in consumption, you ensure that the tannins in the tea do not have the opportunity to interfere with the absorption of the mineral in your intestines. The impact of black tea is also particularly significant for those taking bisphosphonates, which are medications used to treat and prevent bone loss in conditions like osteoporosis. Much like the interaction with iron, the tannins in black tea can interfere with the gastrointestinal absorption of these bone density drugs. Research indicates that tannin molecules bind directly to the medication in the stomach and intestines, forming complexes that are simply too large to be absorbed effectively. This can significantly reduce the concentration of the drug in your system, rendering the treatment much less effective over time. Fortunately, you do not need to give up your black tea ritual entirely if you are on these medications. The solution lies in taking your bisphosphonates on a completely empty stomach with plain water and then waiting a sufficient amount of time before you have your morning tea. This allows the drug to pass through the digestive system and enter the bloodstream before the tannins arrive to cause any interference. For individuals managing respiratory conditions like asthma or chronic obstructive pulmonary disease, the interaction between black tea and a medication called theophylline is a matter of serious concern. Theophylline is a bronchodilator that works by relaxing the airways in the lungs to make breathing easier and prevent symptoms like wheezing or chest tightness. The primary issue here is that the caffeine found in black tea competes with theophylline for hepatic clearance, which means they both rely on the same processes in the liver to be removed from the body. This competition can lead to an accumulation of theophylline in the bloodstream, reaching levels that can be potentially dangerous. If the concentration of this medication becomes too high, it can lead to severe headaches, tremors, and other toxicity-related symptoms. Because of this high-risk interaction, pharmacists such as Jane Moon strongly advise limiting caffeine intake or avoiding it altogether if you are utilizing theophylline as part of your respiratory treatment plan. While these interactions are serious, they do not mean you have to abandon black tea if you are a dedicated fan of the drink. There are several practical steps you can take to preserve the quality of your tea while minimizing the risks to your health. First, it is important to pay attention to how you store your tea. Leaving tea out in the sun or exposed to air can reduce its potency and freshness, so it should always be kept in an airtight container in a cool and dark place. Second, you should be mindful of your steeping time in the kitchen. Experts recommend steeping black tea for only 3 to 5 minutes because steeping for any longer than 5 minutes allows a much higher concentration of tannins to enter the water. This not only makes the tea taste more astringent and bitter, but it significantly increases the level of compounds that can bind with your medications. Temperature also plays a role in the chemistry of your tea, and it is generally recommended to use water that is just below the boiling point or around 200 degrees Fahrenheit. This prevents the tea from becoming overly bitter and helps maintain a balanced chemical profile. If you find that the caffeine specifically is causing the interaction with your medications, you might want to consider switching to a decaffeinated version of black tea. This allows you to continue the ritual of your daily cup and enjoy the flavor while dramatically reducing the risk of stimulant-related interactions or liver clearance issues. By making these small adjustments, you can maintain your love for tea while ensuring your pharmaceutical treatments are working exactly as they were intended by your healthcare provider. The overarching takeaway for anyone who takes daily medication is that the timing and consistency of your habits matter just as much as the medicine itself. You should never feel like you have to navigate these complex interactions alone. It is always a wise decision to have an open and honest conversation with your doctor or your pharmacist regarding your tea and coffee habits. They can provide personalized advice based on the specific dosages and types of medications you are taking. In most cases, simply spacing out your tea from your pills can help you avoid 90% of the potential problems. By being proactive and following these professional guidelines, you can ensure that your antioxidant-rich tea remains a benefit to your health rather than a barrier to your recovery. Protecting your well-being is a matter of understanding the chemistry of what you consume, and provided that you follow these expert tips, you can continue to enjoy the global favorite that is black tea with total confidence and safety.